Namaste, I'm Dr. Bhaswati Bhattacharya, and I'm here at the pre-summit on health at the Vibrant Gujarat 2022 function being held at the Leela in Gandhinagar. I would like to thank Dr. Manoj Aggarwal and everyone at the Department of Health and Family Welfare of the Government of Gujarat for inviting us to speak about Ayurveda and AYUSH in terms of health and wellness. Today, I'm going to talk with all of you about the theme of holistic healthcare and specifically about best practices for holistic wellness. This slide presentation was scheduled to be delivered in person so that there would be question and answer, but due to the circumstances right now, I understand that this is being postponed, and I still wanted to have a chance to share this information for anyone who was looking forward to hearing about it. So I begin with obeisance to my teachers and my gurus, as is customary in Ayurveda, because we thank our teachers for everything that they have imparted to us, because there was always a choice when teachers teach that they could not have shared with us, and instead they did, and I'm ever grateful to them. Today, I will talk about wellness. However, as an Ayurvedic person, a practitioner in the USA, called an Ayurvedic doctor in the USA, but as an Ayurvedic practitioner and researcher in India with a PhD in Rasa Shastra and Bhaishya Kalpana, which is the science of making medicines. I have been practicing Ayurveda through the traditional classical way of being trained, which is called Gurukula. It is the system with which a one-to-one relationship between teacher and student imparts the knowledge, the deepest non-written knowledge of how to practice. And that is how I started learning Ayurveda. And so I've been practicing for almost 20 years in that way. Along the way, I've also gotten formal degrees and certifications because of the nature of the modern world, which requires credentials. But I have always learned from my guru that the competence of being able to practice is the main. And in Ayurveda, there are several levels. There is a level that is about wellness, which is what I'll talk about. But Ayurveda is not just for wellness, it's also for intervention of chronic diseases. And it's also an excellent treatment for emergency diseases. And oftentimes the wellness is emphasized, but the intervention and the emergency is not emphasized. And so I welcome you to go and find more about that, but I'll mention a few things about that briefly in this talk. There is a shloka that says that Ayurveda is for the conservation of health, swastasya swasthya rakshanam. But it also says that it is very good for intervening and bringing people back. Aturasya vikara prasamana macha. And there are several shlokas that talk about how to define health and how to balance the body so that it's healthy. And in the case of several shlokas, they talk on a doctor's level about how to actually balance the dosha, samadosha, samagnischa, samadhatu, malakriya. There's a shloka that says that the physiology must be in balance, but the physiology isn't just the physical physiology, it's also the mental physiology. And with that, the greatest wealth, which is health, comes in and stays in. And then that is a state of wellness. So there are some tenets in Ayurveda that are very important for understanding its approach. And of course, people will say, well, why not just use modern medicine? I'm trained as a modern medical doctor, and we know that there is a whole rubric around evidence-based medicine. So I just want to briefly remind everyone that modern medicine, known as allopathy or biomedicine, is a third leading cause of death in the United States. And for those who have analyzed it, there are several groups actually that are looking at this. The evidence that supports the practice of mainstream medicine in terms of evidence-based medicine is really not that good. In one study, only about 18% of the recommendations that are given were actually evidence-based, that are used in mainstream practice. And the rest of it is just done because it's being followed by doctors like me who are trained by their seniors. What is not evidence-based medicine is ignoring the individual patient, allowing practitioners with lack of expertise to just publish papers and make clinical decisions, lack of understanding the research evidence, and lack of conscientious use of the data. And these four tenets are actually the predominant practices today in modern medicine. And it's one of the reasons why I got into practicing integrative medicine and got interested in Ayurveda, because Ayurveda actually does emphasize individual patient values and preferences. And it by necessity makes clinical choices not based on the disease, but based on the patient, both their manobala, their mental strength, as well as their physical surroundings, who's there to help them, and what their physical tools and resources are. It does not encourage practitioners who have lack of expertise to just practice, although there are many people that do. And there is a big emphasis on self-care and the responsibility being on the patient, rather than just running to the doctor and making it the doctor's responsibility to take care of the patient. Ayurveda does have a lot of research evidence, but modern medicine and most lawmakers and policymakers do not follow that research evidence, although that's changing slowly. And the data that are there that we call practice-based evidence are the basis of why we say that Ayurveda works, because we've watched it being handed down generation to generation to generation, uninterrupted for 10,000 years. So the recommendations I'm using aren't just things that I made up in a laboratory or synthesized chemically and then checked on rats to see if it works. These are recommendations that were handed down by my grandfather's 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 grandfather, and then given to me or to my teacher who gave it to me. Ayurveda, when it looks at wellness, uses these same principles, but focuses on staying well. So there is a adage of ahara, vihara, oshadam. Ahara means food. And so we look at the ingredients of food. Ayurveda spends a lot of time teaching doctors and those who want to learn about the ingredients. And so this classic textbook called the Ashtanga Hridayam has 2 chapters that are specifically devoted section by section on each type of food and tell exactly what to eat and what not to eat in order to get certain shifts in your what are called your doshas, your vata, pitta, and kapha, which are these themes of the body. And these themes dominate our functions. We have each of the sections of food or types of food, and the recommendations are so precise, they are not found anywhere else in any other system. So the ingredients are important, but the ways that they are made are also important. So for example, when we teach about the shimbidhanya, which are the dals or the beans, we first teach what's the difference between a bean and a pea, a legume and a gram, or a lentil or a pulse. And after we've taught the differences between them, then we say that, yes, it's the green gram that is the most healthy, what's called mugda or moong dal. That is the easiest to digest and it's the healthiest overall. Whereas masha, which is known as urad dal, or some people will call it black gram or black lentils, that is less easy to digest. And so in general, if we want to stay well and we don't know what to eat, a great overall recommendation is to have rice and beans. It can be in the form of cooked rice, it can be poha, it can be idli, it can be dosa, it can be uttapam, it can be so many different dishes in the Indian subcontinent, but it can also be from other parts of the world. Rice and beans, edamame and boiled rice, There are so many different preparations around the world of rice and beans. And scientifically, it's been found that to stay well, to have our tissues develop and to stay strong, this combination of rice, which has a tendency to fill and fulfill the body and the needs of the tissues, and the astringents of a bean type of a dal, this combination actually synergistically allows both the components we need in the rice and the components we need in the beans to come into the body, not just through our mouth into our belly, but across the belly into our blood system and into our tissues. Modern medicine still has not figured out how to study what's in the tissues. They only study what's in the blood. Ayurveda talks about a quality called prinanam, which is about the way the cells pull in those ingredients from the blood cells. So understanding these ingredients one by one is a really essential part of understanding Ayurvedic nutrition. But that's not all. We also need to understand non-nourishing processes. So I call these the 7 deadly white foods because in the USA, these are all very much processed. There are samskaras or processes that make each of these actually not good for the body if eaten in the wrong way. And there have actually been conferences held that show the reasons why, for example, enriched wheat flour, refined wheat flour, is actually bad for the body. The science is known. The question is, when will the industry, the trade, and the people choose not to have these non-nourishing processed foods? Ayurveda also talks about fasting and langhana, which in Sanskrit is known as upavasa. So eating more lightly or eating foods that are easy to digest, not just caloric restriction, as shown in some of the scientific articles, but the foods that will allow the belly to rest are very, very important for maintaining that fire of the body and the digestive capacity. There are articles in the scientific literature that talk about the cerebral cortex, which is the part of the brain that not only thinks, but processes, and how it influences the stomach. So it's not just the carbohydrates, fats, and proteins that we're eating, it's how we eat them. And the kala bhojanam, which is the who, what, when, where, why, how, although kala means time, this entire series of everything around our food, who we eat with, how noisy it is, how much wind or sun or noise is coming into our system as we consume the food, what our food looks like, how hot or cold is it, how long ago was it cooked. All of these change the way that we process foods. So to stay healthy, a best practice is to understand how to eat your meal in the most optimum way so that your nutrients in that food can actually be absorbed. Another is to understand plant-based. So the idea of a plant-based diet was introduced in the 1980s through a study of several rural Chinese people who didn't move around much and who ate very simple food. And it turns out that they were eating minimally processed fruits, vegetables, grains, nuts, seeds, beans, herbs, and spices, and excluding everything that is animal-based as well as anything that is an animal product and anything that is processed. And they found that those people, when compared to Europeans and Americans, the 3 groups that did the study were in China, the USA at Cornell, and in Oxford in the UK. And they found that compared to the Western population, the Chinese population did really well. And they pinned it down after looking at all the factors. They pinned it down to the fact that plant-based diets are actually much, much healthier. So if you're looking for an overall generalizable factor, you can say that focusing on a plant-based diet and eating less processed foods is going to be better for you. Now, of course, that depends on your environment. And Ayurveda really emphasizes understanding your environment, not only for pandemics, where the annihilation of populations known as Janapada Udvamsa is focusing on the air, the land, the water, and how time is affected. But in general, best practices of wellness look at your particular environment and how you should specifically behave in your environment. Now, instinctively, most people know that if you live in a very cold or very high altitude environment, you need to have several layers of clothes, generally natural fibers like cotton, wool, and silk. People that live in temperate environments, the Southern Desha, they can be a little bit more flexible. And people who live in very, very swampy land need to have very nicely aerated cloth like linens and cottons. But they also need to have food that is attuned to that environment. They need to have lifestyles that are attuned to that environment. And they need to have medicines on hand that are attuned to the particular environment they live in. And that again goes back to the Ahara, Vihara, Oshadam that I mentioned earlier. Ahara being food, Vihara being lifestyle in general, and Oshadam being different kinds of medicines. We also look at best practices based on our inner and outer rhythms. So in terms of the outer rhythms, we look at the cycles of Vata, Pitta, Kapha that change during our seasons. So we have 6 seasons in some lands, 4 seasons in other lands. Every land, whether you're up at the Arctic Circle or at the equator, is going to have a little bit of change in tides and seasons based on the changes of the moon, the lunar cycle, and the solar cycle. And so learning to live with those inner and outer rhythms, the solar rhythm in case of seasons and the year, and the daily rhythm of the earth rotating day and night creates the circadian rhythm. There's a lot of work on dinacharya, which is known as daily rhythms. And if there's just one thing that I would leave you with, it would be that the best practice that you can do if you're just starting with Ayurveda is to learn how to live a good dinacharya, a good daily routine. Because we know that clock genes affect not only overall things like our health and wellness, but specifically our different organs. So I've had many patients who read about dinacharya and talk with me and say, you know, I had a thyroid problem, or I had chronic fatigue syndrome, or I had an incurable headache or insomnia or menstrual difficulties. I changed my dinacharya and got it aligned, and the problems went away, which are very seriously diagnosed medical problems. They went away. How did this happen? It's because our clock genes, our molecular clocks in our body align with the day-night cycle. And when we get in tune with our ecosystem, everything changes. Not only our mind, but the chemicals in our mind that then affect our body. The digestive fire, which is called Jataragni, is the fire that helps us to digest food, which then becomes the energy and the fuel that then help us to keep our mind happy, our immune system strong, and our body healthy and robust. In addition, our cells are made of minerals. There is a concept called the human metallome, and that is composed of all these different metals that are in the body having all different functions. And when they are depleted, which they often can be as part of disease, modern medicine hasn't yet figured out that we need to replenish those. Ayurveda does understand. So one of the best practices is to take foods and sometimes some medicines that contain what are called bhasmas, nanoparticles of metals and trace minerals. One such is Abraka Bhasma, which has none of the heavy metals that are dangerous, according to the Western world, which are arsenic, cadmium, lead, and mercury. But it does have aluminum, silica, magnesium, vanadium, and source of trace minerals and metals. And what we find is that patients who are convalescing from a serious disease, whether it's cancer or COVID, or if they're emaciated, when we give them the replenishment of these minerals in their body, they tend to get better. And as time goes, there's more and more biochemical evidence of the lung enzymes and the blood enzymes and the liver enzymes that are dependent on metals such as copper, we know iron, and many of the trace metals. And so having some good metals in your diet is important. A great way, if you don't have access to bhasmas, is to eat the brassica vegetables, the dark green leafy vegetables, and have a regular amount of them. And make sure you include dhanya, which is coriander leaves. We sometimes call it cilantro, because that tends to chelate out extra heavy metals that are in the body. And as every Indian knows, coriander chutney and coriander dhanya patra are an essential part of our diet. Ayurveda has many, many modalities. It's not only food or not only lifestyle. There's a huge number of interventions in diet and lifestyle, but there's also a huge number of interventions that involve the mind, that involve hands-on work on the physical body through massage and through oils. There are detoxification therapies and build-up therapies, which are called rasayanas or rejuvenation therapies. And then there are therapies that focus on the subtle energies, which Ayurveda really focuses on. And those involve the mind and the subtle forces of gravity from the outer extra earth bodies, such as the planets, which we call the grahas. And so if we look at our nakshatra, there are many people who align their best practices of wellness with their nakshatra, their lunar, which is affiliated with your mind's function, their lunar rhythms. I want to end with a couple of recommendations. This is a travel kit and a beauty kit that I give to each of my Western patients. So the travel kit, I love to recommend because these are best practices for staying well when you're traveling, like everyone who's here in Gandhinagar. One is to carry triphala, because if you are not pooping every day, it's very important to keep your gut clean and to just help your body to clear out your bowels each and every day. That doesn't mean that one day without pooping is okay. It means you should really try. If you don't have triphala, you can have prunes, you can have raisins, you can try to have hot water that will help clear and push things down and out. And triphala is easy to carry and it's very light in the suitcase. And so we recommend people travel with triphala, especially when they go to hotels where food is oftentimes not served from freshly procured ingredients. They're frozen or they're oftentimes kept for a day or two. We also recommend in the travel kit to keep turmeric for wounds, because when you get cut, if you're traveling, turmeric is a supremely excellent hemostatic. I use it in the emergency rooms in the US and in India because it's better than almost any pharmaceutical drug. It's cheap and it's effective and it's easy. It's also very portable. I keep an entire jar of turmeric powder in my scooty so that in case anyone has a motor vehicle accident, I can go over and sprinkle some on their wounds. And I've helped at least a dozen people, unfortunately, after accidents with the turmeric. It's also great in the kitchen in case you cut yourself with a knife. But when you're traveling and you happen to just get cut, it's nice to know if you have turmeric in your travel kit that you can stay well and not get sicker, not get infected, and not have to go to the hospital. In addition to being a hemostatic, turmeric is also a very good antimicrobial and a very good anti-inflammatory. Dashmulvati is great for pain. It brings down the vata, especially when we're traveling, our vata is high. So I ask my patients who tend to travel a lot to carry Dashmula with them. Brahmi calms the mind. And so for people who are traveling, they have jet lag, they have some kind of deadlines, and they're just not able to rest very well. They don't feel calm. Brahmi helps them to feel calm. Shunti is dried ginger. It's excellent for respiratory issues. I love amalaki, which is also known as amla or avla. Amalaki is the Indian gooseberry, which we can see up here, this green one. It's one of the 3 fruits of triphala, and it's excellent for reducing radiation issues that happen when we fly at very high altitudes. So I especially recommend this for people that travel over the north of Europe, either going to one of the Northern European countries or traveling over Greenland to get to Canada and the USA. I've had pilots who have had aplastic anemia and other blood disorders, which the doctors could not figure out. And I hypothesized that it was because of the radiation from flying and gave them amla. And first I gave them an intensive prescription because they were very ill, but I asked them to use it also preventively to maintain wellness. Every single one of my patients has recovered from that anemia. And part of it is most likely due to amalaki. I also keep Shatadhaut Grit, which is 100 times washed ghee, or at least ghee for burns. Now, when you're traveling, if you do have a burn from the iron in your room or very hot water, it's very, very inconvenient. Ghee is also very useful as a beauty remedy, which I'll talk about in the next slide. I've mentioned turmeric before, so that's a duplicate. And I've got sesame oil in here, a little jar or a little bottle of it. If heated up on your hands, or maybe if you have a cup in your room that you can heat it in, if you rub that underneath the feet and on the soles of your hands, and then go to sleep, you'll see that it reduces the vata and people sleep much more solidly. It's a great thing also to put on right as you get onto the airplane during a long flight, because it will bring down your vata as you're traveling. And then I have people travel with neem powder, because if there's an acute gastrointestinal disturbance, either from some food poisoning or maybe the food was just not cooked properly, it will immediately intervene because of its potent antimicrobial chemicals, you can say, or the whole neem leaf having that property of being antimicrobial. Neem bark, neem leaf, neem stems have been used for millennia because of their antimicrobial properties. And onto the beauty kit. The beauty kit has many things in it that many of my patients who are musicians or performers, stage artists, people who work in Bollywood, and also politicians who have to give speeches often. They want to look fresh, they want to look as healthy as possible, and they want to look good. So I recommend these things for a beauty kit that either is at home or travels. Besan is chickpea flour. I take chickpea flour, put in a little bit of water to make it paste, like a toothpaste consistency, and just apply that onto my face, especially where women have and men have these wrinkles around their forehead, outside their eyes, and around their nose and their jaws. And besan, chickpea flour, tightens the skin. I leave it on for about 10 minutes and then rinse it off. And as the besan dries on the face, one can feel the skin tightening. Doing this twice a week, 3 times a week, one can see a noticeable improvement in one's face. Sometimes people add a little bit of turmeric, although some say that will make the skin a little bit darker for a few days if you go out in the sun. So I use the turmeric for people who have some acne that they need to just clean that out in a day. I also use it for once a month cleaning if I've been out a lot in smog, like in Delhi, or in severe dirt and pollution. Otherwise, I use sandalwood. Sandalwood paste, as we can see here, is very, very good. It's a great way to stay well, and it's one of the best practices for wellness in the Indian culture. Taking sandalwood stick, grinding it on a stone, and using that paste to put onto the face, letting it dry overnight, and then rinsing it off in the morning. Sandalwood is also extremely cooling. And so if you've got any kind of acid reflux, or you have a lot of heat coming through your body, you can take the sandalwood and put it in your belly button opening. And if you don't have any kind of cold or respiratory phlegm, you can put it right at the base of your neck, and it will cool your voice. It will allow any raspiness to resolve. Sesame oil we talked about before, it's very, very good on the skin. And so pre-bathing with sesame oil will allow the skin to have a luster that almost no lotion can give. Castor oil is very good for regrowing eyebrows, making them thicker, putting them on the eyelashes to make them thicker, and using them on little bald spots where you'd like to have hair regrow. Before using the castor oil, take a little bit of coconut hairs and just abrade the area very quickly so that there's a little bit of blood that comes to the area. So it calls in a certain amount of blood cleansing, and then put the castor oil and the hair follicles will regrow. It's actually best to have an Ayurvedic Vaidya help you the first time so that you learn how to do it if you don't know. Coconut oil is cooling. I have people put it in their hair as a night hair oil or for 3 hours during the day and then wash it out. Coconut oil cools the head, and if you have a lot of pitta, as many performers, musicians, and lawmakers do, it'll cool down that anger and that tendency to heat up. And it's very, very great for the hair. Raw eyes is great for cleaning out, raw honey is great for cleaning out the eyes. Madhu or honey, sheher, has to be procured as raw honey. It cannot be commercially made honey from invert sugar. It has to be the honey that is made by bees. If you can get some of that from either the Gandhi Ashram or a company like Organic India or somewhere that makes raw honey, take a drop of that on your third finger, open up the bottom of your eyelid, the bottom eyelid, and place it in that space. It will burn for 20 seconds. And then after that, it will clean out your eyes, and your eyes will not only be clean, but they will become white. The sclera part will become very, very beautiful and sparkly. Ghee, as I mentioned in the last slide, is great, not just for burns, but it's great for face cream at night. So if you travel with it and you put it on your face at night, you'll notice that it will not get dry, and it's very, very useful. Rose water is for sunburns, and milk cream is very good for cooling the skin in case it gets overheated. So to know specifics on how to do this, an Ayurvedic Vaidya uses something called the Dasha Vida Pariksha, 10 factors that actually allow the physician to take those best practices and individually tailor them to any particular person. So if you don't happen to be an angry person, you don't need coconut oil, what's the best oil for you for your particular dosha? Not only the dosha of what you're feeling right now and your condition right now, but your baseline constitution as well. And these 10 factors are also used to know how much strength a person has so that we can dose their medicines. The usual talk on lifestyle is diet, exercise, stress management, and how we make our food choices. And we don't really understand in modern medicine exactly how to reduce inflammation. We know the chemicals involved. We know many of the things that will occur as disease when inflammation is high, but we need to move to a place where we understand the gestalt, the overall routines that will help us to reduce inflammation. And I hope that I've been able to convey some of those specifics in this talk for you today. I want to end with 2 slides. One is about the emergencies that we have that bring us fear. Ayurveda has many, many medicines and interventions for emergencies. And some of them were in the last 2 slides that I gave around beauty and around the travel kit. And these are all things that can be used in situations of emergencies. And I put this here because I want to remind you that part of staying well is to feel prepared, to know that you can intervene as you need to, and not just stay well in this elusive kind of fantasy state of nothing ever going wrong, but knowing what to do when things go wrong. And Ayurveda does prepare us for that. My last slide discusses the two factors that I think that have kept the pandemic at bay for a huge number of Indians, mostly those who are traditionally following Ayurveda and or living in lifestyles that are actually Ayurvedic without realizing they're Ayurvedic. One is the use of dhupa, the smoke and the flame and the herbs that we light in the morning at morning sandhya and in the evening at evening sandhya, whether it's agarbatti or it's the earthen pot with the smoke that we take around to every room. That actually does have a cleansing effect in the room. And its value is absolutely undervalued, understated in India. And it probably is one of the things that developed during the time of the plague in Europe from 450 to 1450, when the plague was killing a third to half of the people every 30 or 40 years for 1,000 years. During that 1,000 years, nothing happened in India. And one of the reasons is that we followed these practices in our day to keep us well. The other was to understand Uchishta, which is known as Juta or Eto or Enjalu, different words in different languages. If you have that concept of knowing what to touch and what not to touch, how to drink from a glass and not share it, how to take off your shoes before you enter the house, and generally the idea of hygiene. These are some of the things that prevent spread of illness and keep us well. So I hope that I've been able to impart some interesting and useful information and best practices on wellness for you. I'd like to dedicate this session to my mother, who taught me the ancient wisdom of Ayurveda and robust, real wellness and health, and welcome you to write to me through finding my website, drbhaswati.com, if you have any further questions. It's been a pleasure, and I thank the organizers for inviting me, and I hope you'll find this talk useful. Namaste.